Our G60 program came from Dr. Mangrum. It was her vision that this all came about.
Good morning.
Good morning.
Good to see you again.
Well, the G60 rounds, it's very important. We have all the disciplines that meet together, not only the trauma team with the surgeon, it's pharmacists, it's respiratory, it's dietary, it's physical therapy, case management, social worker. There's been studies that this whole teamwork actually creates better patient outcomes. Before, things were missed. Patients' home meds weren't restarted. They weren't on the proper dietary needs.
During rounds, having all the specialties together helps, because if there's any question that the patient has or hesitation that one specific subspecialty has about moving forward with either transferring the patient, going to the operating room, moving them, leaving the hospital, all of those can be addressed at once, and we don't have to wait for somebody to round on the patient. We don't have to wait for other perspectives, other opinions. We don't have to go and chase down subspecialists. This is where we can come up with plans for the day, all in the beginning of the day.
So we're recommending home with home health physical therapy and a front wheel walker.
Are we going to be able to get that walker for her?
Yes, we can set up the walker and also home health services.
Okay, excellent.
I think the patients really like being involved or having the team all involved. They feel that they're getting more attention and that everyone is on the same page and we're all working together, and they know that they're going to have a better outcome. And I think that really does put the patient at ease, knowing that they have all these people looking out after them.
From our perspective, probably the care comes first and foremost. We all understand what the plan is, we're all working on the same goal, and our goal is always to be able to get the patient back home as soon as possible. Then they have less chances for any complication.
Starting at this program, I'd never taken initiative to take care as a primary doctor of these G60 patients. They would always be taken care of by someone else, and I'd give some recommendations. But now that we've taken ownership of these patients, I have a whole well-rounded team that is able to be much more aggressive with these patients.
Nutrition is very important. You know, you need those calories to help you get stronger. Okay.
The sickness and the illness that's going to come to the G60 patients are the problems that we find after they've been lying in bed for a few days. They're going to get muscle soreness, weakness, breakdown. They're going to get bed sores. They're going to get blood clots. And so knowing that, you know, up until yesterday they were out walking, we want to get them up today and walk them again. This is not somebody who was bedridden at home, so we're not going to have them be bedridden here in the hospital.
We all had input into the design of the room. One of the features that we put foremost was that we wanted to feel more like home. All the medical equipment is behind cabinets. Our bathroom is probably the most well-known feature. The patients love our bathroom. They tell us many times that they wish they had this at home.
It's just great to be with these group of people. We're just bringing our expertise, and we get to see the whole picture for the patient, but it's just great to see that the patient's total care is being addressed.
The goal is to be able to get the patients home sooner, have less complications, and to have their length of stay reduced. And through the G60 program, we've been able to do that.
All right, well, you keep working.
Okay.
Okay.